Okay, welcome to Year 8 Science Online with Henny van Vieren.
Yes, so today we're going to be looking at just re-looking at those medical cases I had you do just regarding the malnutrition. I think the last time we did it, it was a little bit unsettled in the class with the whole um, shutdown for coronavirus and so forth, so I thought we would go over that again. Okay, so here we go. We said that you are a doctor at Auckland Hospital. You need to identify what is wrong with the patients in the next three slides. So working in your groups, unfortunately you couldn't work in groups because you had to do this at home. But however, you needed to come up with a diagnosis and evidence. So in other words, you had to take the symptoms and go and Google them and then find out what is wrong with the kids. So the first case, and all of these cases are genuine cases, by the way. This happened between 2007 and 2009. Unfortunately, 54 babies passed away in Laos, which is a country in Southeast Asia. Now, the babies were all breastfeeding, getting milk from their mom, and then they got sick, and 2 days later they died because of heart failure. They said it was definitely not a lung infection, so no COVID-19 or SARS over here. Okay, they couldn't sleep. They absent. Oh, sorry. Um, they had an absence of their deep tendon reflexes. They were coughing. Cyanotic means they didn't have enough oxygen, or um, yeah, and dyspnea. I can't for the life of me remember what that is now, but lots of crying and then suddenly a loss of voice. Most of these kids, unfortunately, were not immunized. Now, when we look at the mothers, they practiced something called food avoidance after they had their baby. This was a tradition amongst the specific tribe in Laos. So for the first few months, they did not eat popular Lao foods. This included they had no vegetables, raw or fermented. They had no fruits. They had no meat, any type of meat, or fish, and didn't have any white-skinned mammals. I don't know what that means. And they didn't have any liquid meals and sauces, or they didn't have any sugar and spices. The only thing they drank traditional unsweetened herbal tea, and for the first few weeks they only ate glutinous or sticky rice with salt. That's it. So tea and salt for the first few weeks. After more than a month, they could have polished rice, which is just, it's not too glutinous, and also black chicken twice a month. And I imagine black chicken is barbecued chicken. They had edema. Edema is the buildup of liquid in their legs, and they had leg pain and paresthesia, which is something that you need to go and look up. They were very weak. They couldn't get up when they were squatting, and that showed us that it could be something to do with their diet. Okay, so we'll come back to the child case next, but let's go and look. So the mothers, as we said earlier, they practiced food avoidance. So they had no vegetables, no fish, and so forth. They only drank sweet tea, not unsweetened tea, sorry, and rice. And because the babies were breastfeeding from the moms, and the only food the babies were getting was based on the food that the moms had, the moms didn't take in a balanced diet. So the moms, they actually were not eating properly, and the babies didn't get vitamin B1 in the breast milk. And consequently, they developed a disease called beriberi. And unfortunately, 54 of them died because of this beriberi, because after a while their heart just couldn't do it anymore. And that is the edema in the mother's legs. As you can see, it's very swollen, and then when you push on it, the water in the cells kind of go away. So, yeah, very sad case. If the mothers ate a more balanced diet, these babies would have survived. So, case two, you're still this doctor at Auckland Hospital. Child Protection Services brings in a 3-year-old child that has been severely neglected. The child displays some of the following symptoms that make you think that the child could be malnourished. They had changes in skin pigmentation and hair color on different places. What that means is that their skin color was different, so they would have darker spots and lighter spots in their hair and on their skin. They had diarrhea or runny tummy. They had fatigue, they were really tired. Some of them who had wounds, they had really bad wound infections. Very irritable means they cried a lot. They had a very large belly, some skin rash, and also swollen legs. So you were to go and investigate these and find out what you think, what malnourishment could have caused this. And the answer to this is something called Kwasiorkor. Unfortunately, it is something that is seen quite a bit in underdeveloped countries, but it is a lack of protein in the diet. It's very sad because the moms and dads are trying their best to feed their kids, but usually they're from poor families who cannot afford meat and so on, so they only eat something that is a very simple diet. In Africa, this usually happens when they only eat maize, and they take the maize and they ground it up and they turn that into a type of porridge, maize porridge, and then that's all they eat. So unfortunately, they don't have protein, and every cell and our bodies contain protein. So we need protein in our bodies, and we need to take it into our diet. Otherwise, we cannot build the proteins. And if you think about it, your muscles and so forth, all proteins. Okay, and you need the protein in your diet to make the body repairs. It's especially important if you are growing or if you are pregnant, and this is a boys' class, so I hope none of you are pregnant. But if the body lacks protein, growth and normal body functions will begin to shut down, and then kwashiorkor may develop. The skin color, changes in their skin color or pigmentation and hair color on different places could develop, and then also diarrhea, fatigue, which means tiredness, very irritable, large belly, and swollen legs. And if you look at this picture here and you look at the little feet of that child there, you can see it's swollen. Okay, so this is kwashiorkor because they didn't get any protein. Now, then the case of a vampire. So you're still in the hospital, a very poor corn farmer. Okay, so that's maize. The Americans call it maize. So like popcorn, corn in the cob. So a very poor maize farmer was brought in by the police after the community tried to kill him because they said he was a vampire. The farmer is known as a big raw food advocate. He was all about raw food, raw food, raw food. And the farmer was extremely sensitive to sunlight and kept indoors with the curtains closed. What was he doing behind those closed curtains? He had weird skin scales on some areas of his skin. Other areas of his skin was very, very shiny. He couldn't sleep. He was active at night. And this was usually because he didn't want to be in the sun. Okay, and remember we said he was extremely sensitive to sunlight. And he was very scared, but became very aggressive when you asked him too many questions. His lips was full of dried blood. When asked what he would like to eat, he said he would prefer raw meat or blood. How strange. Now, this is where the legend of the vampire was born, historians think. It is something called Pellagra or Pellagra. It's a disease when you have very low levels of vitamin B3. So, also known as niacin. So the symptoms are dementia, which means your brain doesn't work, diarrhea and dermatitis, red flaky skin, thick, crusty, scaly or cracked skin, confusion, irritability, mood swings, anxiety, disorientation or delusions, believing things are not true. Normally people, when they eat food, you get vitamin B3 from yeasts and meat and poultry and red fish and so forth. So this is extremely important for especially vegans, because they can actually become niacin deficient. And you can see everywhere where their skin actually is exposed to the sun, and they get sunburnt, they can develop these scales almost. And the reason why they have blood on their lips is usually because their lips crack and then they bleed from that. Um, so, yeah, if you don't have all your vitamin B3, you can get something called Pellagra. Okay, and the last case was what's in the blood. A 50-year-old male patient presents to the emergency department at 2 o'clock in the morning with vomiting and abdominal pain. He had a 2 week history of excessive urinating. What does that mean? That means he weed a lot. And also excessive thirst. He was extremely thirsty and weed a lot. And he lost 20 pounds of weight and he had blurred vision. Now, this was obviously 20 pound, I don't know what that is in kilograms. I should have turned that over, but never mind. He had a history of high blood pressure, but his blood pressure on admission was 135 over 80. And we know that 80 is relatively normal. 135 is slightly elevated. So the history of had high blood pressure, but it seems that this currently is not the problem. Results of the hospital lab studies revealed that the patient, his initial blood glucose level, when he arrived, the glucose in his blood was 1192, which is very, very high. His father unfortunately passed away at the age of 35 due to kidney failure. So, what was in his blood? It's called diabetes, a disease where your body cannot control its blood sugar levels properly, either because your body doesn't make enough or any insulin, that's usually diabetes type 1, or because your cells have become resistant to insulin. And this is frequently because of diet. If we have too much sugar all the time, it's almost like the boy who cries wolf. It's like sugar, and then the the body will make insulin. And if you have too much sugar too many times, your body can actually become resistant to the insulin. And consequently, when the sugar comes into your blood, your body says, no, I don't care. So they don't take up. When insulin is released, they take up the glucose. Now, classic symptoms are frequent urination. People go to the loo a lot. Excessive thirst. They drink a lot because obviously they go to the loo a lot. Um, some of them eat a lot. They're always hungry, but they lose weight. And interestingly enough, there's sugar or glucose in their urine. And in the old days, and this is what this portrait was about, the doctors had to actually taste the urine, and if it was sweet, they knew there was sugar in it, and then they knew that the patient had diabetes. They also found out in India that the patients would urinate on the floor, and then the ants would come. And if the ants came, it meant that there was sugar in their blood. So, interesting that they used ants to diagnose this. So, there you have it, guys. Diabetes. You need to know about this disease. You need to know what it looks like and what causes it. Pellagra I put in because I thought it was really interesting. You need to know about Kwasiorkor, and you need to know about Beriberi. Okay, so thank you for watching this lesson. I will post some more work for you to do on the OLE.